Pháp Portugal
Some more.
đang like cầu mà rồi thì chip mà.
Okay, let me enlarge myself. Okay, I need like I need to study, but I failed to capture the you know, the stuff. Okay, the screen. I cannot capture my screen somehow. Hang on. Ah, fuck. Okay, hang on. Okay, I'll just put it here. I will just put it here and let me put on some background music. Moobot. I need a Moobot. Have I actually like used Moobot here before? I don't think so. It's been a long time. Okay, let me find like a maybe this one. I'll have the rat dance here. I mean, recently I've been quite, you know, hooked up to the song. Okay. wait, play. A haro. Okay, there we go. Oh. Wait, can you guys hear it? Okay, it is a little bit loud. Okay. How about this? I think this is better, right? Okay, sure. Where is the... neuropsychiatric syndrome. Okay, stroke subtype, stroke symptoms. I think those are fine. It's just that it would take some time. Okay. Okay, just put it here. Yeah, just put it here. I'm not sure if you can, you know, capture it with OBS, but okay. God. Okay. How about... Can it be captured? Wait. Notepad. How about photos? Maybe like this? No? Yeah, I don't think it's helping, yeah. Oh god. Wrong button. Reperfusion therapy, identify stroke, large vein occlusion, CT brain, oh my god. Nystagmus, bulbar dysfunction, GCS, homonymous hemianopia, tetraparesis. Ooh, okay. Endovascular stenting procedure. Stenting, hey? Đâm ra không có giả. Không có giả. 因為之前嗰隻真係冇味，呢隻好少少。
这个蛮有搞的。
Okay, angioplasty, local anesthesia. Hmm. Subclavian artery, large diameter balloon. Okay. Vertical artery. Balloon mounted base metal. Drug eluted stent. Okay. Intracranial artery. Protection device to capture emboli during procedure. Okay. Mm-hmm. ICA. Okay. Digital subtraction angiography with or without plasty to assess stenotic severity. An overall cerebral hemodynamic to indicate risk and benefit. Okay. 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 Indicate risk and benefit. Right. Hemorrhage. Okay. Rapid progressive neurosigns and symptoms. Headache, vomit, seizure, reduce consciousness. Okay. Neck stiffness. Maybe? It depends. Sometimes, like, at the posterior, like, circulation, if there's an infarct there, then surely. But maybe not at the frontal part? Wait, Nintendo Switch 2? Yeah, I was, like, waiting for the Switch 2 to come out, but, you know, I have no time in, you know, watching Nintendo doing their stream, because, fuck, I don't even have, like, time to play games. Non-contrast CTB. Okay. I wonder if this song is copyrighted. I don't know. We'll find out. See if the VOD is being muted. CT angiography, CT brain. Extensive investigation. Hematology location. Okay. Hypertension history, okay. Small vessel disease on CT brain, okay. Okay. Oh, you need to use MRI. Well, you know, higher resolution, I suppose. MRI brain and flare, okay. Fluid attenuated, like something like that. I don't remember the exact name, but because in general, like MRI has higher resolution than CT, but you know, it took a while to scan. Cerebellar blood pressure. Blood film, INR, APTT, okay. Okay, let me throw away the trash. Okay, be right back. I'll be right back. Okay, urine toxicology, cancer, psychotic aneurysm. Why? Is like fungus there? Blood culture, erythrocyte sedimentary rate, ECG. Interesting. ECG, hey? Wait, where's OBS? I need OBS here, I suppose. No. BP meds. Okay, anticoagulation, warfarin. Okay. Vitamin K. Vitamin K is for coagulation, I think. FFP fluid overload. No idea what those things mean, but okay, I guess. PCC administration. Okay. Ruthermbectinix. Okay. Dysbulia. Wait, why are you here? Dude, I thought you said, you know, we're gonna play something, but you went silent. What happened to that? It was from a long time ago, by the way. You know, the text you're seeing right here, it's from a long time ago. I think... Well, actually, I forgot, but, you know, I think it was like a year ago. when you were having, like, exams and shit. I forgot. I don't quite remember, but there you have it. It was like a year ago. But, you know, now it's my turn. It's my turn to study. So, you know, there you have it. You'll not get good grades. Well, you know, shit, you know. Your ass is gonna get, you know, kicked out. kicked out from school, you know. I mean, I will get mad, but you know, the ultimate person who's gonna suffer is you. You know, sorry, that I'm gonna, you know, be like a mom or a dad or a parent, like whatever, like transparent, haha. You know, I'm gonna nag you a little bit, like if you keep talking about my grades and shit, which is what I'm doing right now. I'm studying, but you know, I'm having troubles in capturing the screen, you know, because I'm using Windows Photo and Notepad to, you know, jot down my notes. So you know, OBS is not capturing that somehow. So you know, you can't see what I'm seeing, but you know, just ask, because I'm currently studying the assessment and treatment for stroke. So, you know, they say, like, you know, within 4.5 hours you need to like rush the patient to the hospital. If the stroke onset is within 4.5 hours, you have to give TPA, like it's a antithrombic agent. So it will melt the thrombi and it will, you know, allow blood to flow through your blood vessels once more. But you know, you can't do it too much, okay? Target INR. INR is the coagulation rate. So which means you know, it will coagulate within 1.3 seconds for normal people. For normal people, blood will coagulate within 1.3 seconds. That's the normal range. But if you get higher, the higher the INR, the more easily you'll bleed out, okay? Bleed out, bruising, those kind of stuff. Target INR, okay. And especially for people who are on, like, who had a, like, poor vascular health, like cardiovascular health, they mostly have been taking a lot of blood thinners, like antiplatelets and anticoagulants. So, you know, sometimes these people will have a higher risk of getting a stroke, especially for like hemorrhagic stroke. You know, your blood vessel bursts in your brain and you're gonna die, your brain's gonna die. So, you know, if that's the case, then, you know, the doctor has to stop the anticoagulant, and they have a table where, you know, like if your initial INR is 1.5 to 2.5, you have to give like 30 like IU. I don't know how to read this little symbol, but you know, mini, like something IV per kg, IU per kg, something like that. Yeah, just in you know, you have to apply like it's a medicine called Prothrombinix, okay? Prothrombinix. And you know, if a person is having that, you know, you have to inject that into a person. 30 IU per kg, okay? 2.6 to 3.5 is 35 IU per kg, okay? I see. Care about studying stroking on. Well, you know, I mean, if you have been stroking all, like, for your whole life, then your brain must be very big. Because, you know, if you've been stroking for multiple times and you're still this smart, you know, you're God's favorite. I mean, both favorite and, you know, the least favorite child. You know, the favorite part is he has given you such a big brain. And the least favorite part is, you know, he's giving you, like, you know, multiple strokes. That's what it is. Oh, God. Okay, 1.5 to 2.5, it's 30. Okay, plus 5, and then plus 15. Still 50. Okay. 30, 35, 50, 50. IU per kg. Okay. But how are you doing though? I thought we're gonna play some games, but you know, maybe not. because, you know, my exam will be on this Saturday and the next Saturday. So, you know, maybe I should try to minimize my, you know, games. But do you want to watch me play, you know, Isaac later? Because before sleep. Okay, I will play one game of Isaac before I go to bed. Okay, do you want to watch? It's Maggie with the Scythe. You know, Reaper Scythe and Brimstone. Okay, I got the 2 ultimate weapons at the same time. I mean, you can say,
Oh, Red Bull, I wanna go watch your stream. I wanna watch you play, you know, Binding of Isaac.
and you know, I can stream to you personally. Okay, premium. Like, or premier, is that how you say it in French?
I don't know.
You know, fuck these numbers. I'm not gonna remember this. Contraindication, PCC allergy. Okay, signs of thrombosis. Okay. DIC. I forgot what DIC is. Oh well, heparin-induced thrombocytopenia. Okay.
I don't know.
Oh well. ICH. Okay, intracranial hemorrhage associated with dabigatran. Okay, it's a blood thinner, a type of blood thinner. Activated charcoal if intake less than 4 hours. Reverse agent. Idarusiku, like Sikumab. I don't know. These, you know, these medicine names. They're gonna make me summon a demon from hell or something. Idarisu. Ugh, God, fuck me. Idarusizumab. Is that how they spell it? Wait. Okay, guys.
How do you spell that name? Let me.
God. Let's see. Idaruci. Okay, how's it spelled? Oh, wait. Idarusizumab. Okay, Idarucizumba. Sounds like a you know, like a cancer, like a medicine for cancer. What? Yeah, that. How did you know? How did you know? Binds with Dabi irreversibly and excrete renally. Okay. IB volus. Okay, how about dabigatran? What does it do? Oh my god, dabigatran. What is that? Okay, it's anticoagulant. I was correct. You know, the life of a healer, I have to, you know, study non-stop. You know, I always say that I love being a healer, but, you know, every time when I have to do admin stuff and to study, I hate it. Like, I hate it immediately. You know, it's like a love and hate relationship. I love my patients, I love my work, but I don't like admin work. It's such a fuss. You know, I should be out there treating my patients and, you know, improving my skills rather than, you know, fixing forms and, you know, doing like yearly plans or like doing some kind of bullshit protocol. Fuck that. This is not what I should be doing. I should be like out there treating my patients instead of, you know, telling my boss that I'm gonna lick your dick until you come so you can give me my money. I don't want to do that. You know, someday, maybe like give me like 5 more years in 2030, I'll open up my own clinic so I'm free from these kind of bullshit things. God damn. Ugh. It's just gonna loop for an hour, Despolia. So, you know, if you want to change the music, just type in !SR followed by a space and input the URL of YouTube. Okay, hopefully it's YouTube, and if not, just give me the name. Sometimes viewers can't really do that, so if you have a song that you want me to play on Moobot, give it to me. I'll play it for you. But hopefully it's not copyrighted and it's safe for work. Okay, I can't have I can't have people canceling my shit. SR exclamation mark SR followed by a space. You must be a retard or something, damn. You're fucking with me. Apparently you're fucking with me. IV bolus 2.5 gram for 2 dose. My god. Okay, ICH associated with factors XA inhibitor. Fuck me. What is the fucking XA inhibitor? Another anticoagulant. Is that it? Okay, XA inhibitor. What is this? Direct factor XA inhibitors, SABANs, are anticoagulants. Okay, fuck. Okay, used to both treat and prevent blood clots in veins and prevent stroke and embolism in people with atrial fibrillation. I see. Okay, I learned a little bit. I mean, it's stroke assessment and treatment, so, you know, mostly we're talking about pharmacology. Specific reversal agent andexamet alpha. Oh, fuck me. Is that how you spell it? Wait. These damn names, you know, fucking doctors in the names. Trying to have me summon a fish from the fire. Andexamet. Is that how we spell it? Andexanet alpha. Under the brand name Andexa, among others, and an antidote for the medication Rivaroxaban and Apixaban. Reversal of anticoagulation. Oh, Saban is also anticoagulants? Okay. Anticoagulation reversal agent.
Ew! I'm learning pharmacology. Ew.
I'm learning. Okay. Binds with factor XA inhibitor. And andexamet. Okay. Okay, less than 7 hours. 800 milligrams IV in 30 minutes. 960 milligrams IV infusion in 2 hours. Fuck me. More than 7 hours, 400. Okay, so it's just conservative treatment. So I assume you don't have any like song recommendations, then I'll just keep on playing the rap song. The rap dance. It's pretty cool. Non-specific reversal agent Prothrombinex. Okay. So it's just all of this just to raise INR. Okay. I don't want to remember those numbers. Like, really. It's not my thing. You know, one of the reasons why I choose to be a healer is that I can say goodbye to math. At least not like algebra or calculus. Like I wanna be away from them. I mean, if you're talking about like simple arithmetic, like add, minus, multiply, and divide, you know, maybe a bit of percentage, you know, because sometimes when you go out and you need to buy something, and like there might be a sale or something, and you can calculate the money.
But no, I don't need more math. Math is not friendly. It's not friendly to my brain. You know, I suppose like all healers are bad at math. Like not all, but maybe 90%. Like except the bullshit people who are into research.
I don't know why. Like, you know, how are you good at healing and research? This is bullshit.
This is bullshit.
Supratentorial intracranial hemorrhage. Okay. Craniotomy. Cut your brain open. Okay, this Boliar, which is what I'm gonna do to you. Cut your brain open and tell your brain that it's not doing a good job in taking care of you. Craniotomy. Cerebellar ICH. That's kind of rare. Surgery if neurodegeneration. Brainstem compression. Ooh, that's nasty. Hydrocephalus. Okay. I want to ask you guys something. Okay. How do you say this? Hydrocephalus or hydrocephalus? I think the British people, the British pronounce it as hydrocephalus. Okay, let me type it down. Hydrocephalus. Yes. Hydrocephalus or hydrocephalus? I wonder. I don't know. It's the same thing as Focalor or Focalor. You know, French. The French. It's such a wee language. Clot evacuation via posterior fossa craniotomy. Fuck me. No ventricular drainage as risk of upward herniation. When to restart oral anticoagulopathy? Like anticoagulants, okay. Post ICH. No at first 2 weeks, resume at 4 weeks. More than 8 weeks if cerebellar ICH, okay. 2 weeks for prosthetic heart valve. 3. Okay. Okay. Stroke prevention. Okay, let me change music. Let me find something. Kirby dinky ass music. I like the dinky ass music. Okay. Okay, here it is. Okay, it's time for the rat song to go. It's torturing you? What? What do you mean? What do you mean? You didn't give me a suggestion. Okay, there we go. Yes! Kirby? Why? What? Kirby's not so bad. Come on. Okay, is this dinky? Yeah, do I? Okay, I may need to raise the volume a little bit. Okay, there we go. You just hate everything I like, okay? That's what you are. I like Kirby, you hate it. I like sushi, you hate it. I like jelly, you hate it. No. No. This is unacceptable. I just find that, like, you know, everything I like, you hate. Like, you and me are total opposites. You know, we are a little bit similar, but, you know, most of the things, total opposites. The only thing that we both like is Isaac. You know, okay, later I'm gonna play Isaac. Because, you know, I need to, you know, relieve my stress. I need to relieve it. Can't do this no more. Okay. Okay, thrombolytic therapy. TPA. Alteplase, tenecteplase. Okay. Yeah. Less than 4.5 hours of stable onset. I know that. TPA convert plasminogen to plasmin. Tenecteplase. Increase fibrin specificity.
Ew.
Increase resistance to plasminogen activator inhibitor. What? What the fuck, man? Plasminogen activator inhibitor. Or activation inhibitor. My handwriting is bad. Work on myself so I don't have to do that no more. Do what? Hate on anything? Like everything that I like? Huh? What, should I just, you know, kneel on, you know, kneel and just start sucking your dick, huh? Be better? Fuck you. I'm trying to. Okay? I'm trying to. You know, you are forcing my Asian accent to, you know, be more apparent. I find that, you know, the more I rage, the more Asian I get with my accent. Fuck you, bitch! You know, I'm not exactly Chinese, like, you know, I think I've told you before. A lot of people think I am Filipino in real life. I'm not, I know my skin is not that white, but, or pale. But, you know, I was misunderstood, okay? you know, people from the Philippines, sometimes, you know, they greet me with Tagalog, and, I don't speak Tagalog. I only understand, like, a few phrases, like, magandang umaga, like, hi, pogi, and then, you know, and, you know, sometimes I would greet them if I know that, okay, I'm sorry for a little bit racist, but this is the demographics, okay? So, most people, Filipino people in Hong Kong, they are domestic workers, which means they go to their house, like someone's house, they help out with chores and housework, and, you know, maybe take care of the young and the old. You know, we call them like maids or domestic helpers, okay? So most of them are Filipino. Okay, most Filipinos here are domestic helpers, okay? I've met some other Filipinos who are working as other occupation, like teachers, dancers in Disneyland, something like that. And, you know, okay, so when I'm pretty sure you guys know by now, you know, I've become a wandering healer, which means I go up to someone's house and I treat them, yeah. Sometimes they have domestic helpers there, and you know, sometimes you can kind of judge their nationality, or you can just ask, okay? If I know that they are Filipino, I would greet them in Tagalog. Like, you know, magandang umaga, that means good morning. Magandang tanghali, good afternoon. Magandang hapon, okay? That's still afternoon, but closer to evening. And I think that's good evening. But, you know, and then magandang gabi is good evening or good night. Okay, you actually say magandang gabi, good night, when it's late in the night, instead of saying goodbye, or you know, you tell that to someone who's gonna go to sleep. Anyway, you know, back to the point. Sometimes they would just think that I'm a Filipino. Okay, I'm a fellow Filipino. Okay, and then, you know, they start to talk to me in Tagalog. You know, maybe sometimes my accent does shift closer to my Asian origins. You know, it depends on my mood. So if you sometimes realize that my accent shifts a bit, especially towards the Asian side, which means I'm you know, using my brain power on something else, so the accent gets kind of, you know, less control on the accent. But, you know, like, it's still sort of like a meld. You know, it's British, American, and Asian accent, like, all mixed together in normal form. And if I study a little bit, like now, if I'm studying, or if I'm trying to be formal, my British accent would just, you know, fly out. Okay, it would appear. It would appear that, you know, cerebrovascular disease is such a dangerous disease, like something like that. And, you know, if I'm like kind of aloof, like laid back, the American accent takes over. I don't know. You know, I think as I age, my accent gets closer to the British accent, because that's the newest accent that I've learned from my 3 years of stay in the UK. But oh well. I mean, you know, Hong Kong English, it is from the British anyway. It is from the British Council, so we are taught to speak in a British accent, which is kind of fucked. But oh well. If you say hi in Tagalog, what do you expect? No. Sometimes not. Like, you know, I don't really say anything. Sometimes I don't even get to say anything, and they tell me hi in Tagalog, like good morning. You know, I know I'm not that pale in real life, unlike this model that I'm having. Like, I'm kind of a little bit white. I mean, I used to be this white, but I think probably it's because me walking under the sun for like a few times, or it's maybe just how should I say? Maybe it's just the mold. I think I'm a little bit mold, or you know, just the dead skin. Because you know the crust of the bread, you know, same thing. You know, it gets dry. So when you bake some bread, okay, the skin is darker than the inside. So maybe when you cut me open, I'm more pale inside, but you know, I'm a little bit more roasted on the surface. So yeah, that's what happens. Anyway, Alteplase and Tenecteplase. Okay. Resistance to plasminogen activation inhibitor. Okay. Long plasma half-life. Okay. Ischemic stroke. NIHSS larger than 8 is going to CT. IVTPA. Mechanic thrombectomy. Whoa. I see. Oh, God. Okay. Convert plasminogen to plasmid. Higher resistance to... Okay. Alteplase and Tenecteplase. Okay. Plasmid inhibitor. Where's the plasmid inhibitor? I need to kill it. Left hemiparesis. Okay, endovascular treatment when symptomatic and risk factor control. I see. Okay, I'm done with this page. Wait, endovascular stenting 2. Am I done with this page? I don't know. Intracranial artery disease. Fuck me. Okay, this boy. Maybe. Okay, do you think it's possible? If I say hola in, you know, hola in what? In Spanish. Hola is Spanish, right? And then, you know, would I be confused? You know, would I be, like, you know, misinterpreted as a Mexican? Because, you know, I don't know if, according to your logic, no? Fuck, no. Hey, don't say anything, you know, even more offensive here, please. I dare you! Don't say it. Okay, ICAD are dynamic lesion. Really? Okay. Therapeutic target. Okay. SBP less than 140. Okay, low density lipoprotein less than 70. HbA1c less than 6.5%. That's for the diabetes. Okay. Quit smoking. 3D rotational angiogram at baseline and after the first year. Oh. Indication for intracranial stenting. 2 strokes despite aggressive medical management. More than 70 stenosis. Good recovery from stroke and modify rank and score less than 3. I don't fucking know what a rank and score is. Oh. I don't know. Hola. Can you say delicioso? Say delicioso. You know, the Dora the Explorer schizo. It is funny. Approach to stenosis. Lesion symptomatic. Okay, intra or extracranial. Focal, multiple, and tandem stenosis. Tandem stenosis is such a fucked up thing. You know, like in a blood vessel, like, you know, you would think that only one stenosis is there, but, you know, it can happen simultaneously. You know, there might be more than one stenosis in the same vessel. So that's what it's called, the tandem stenosis. Like in like CT angiography, you can see like a bead-like structure. So that's what it is. That's what it is. Hello. Hello, Sir Crocodile, aka Vegapunk. How are you? How is your studies and gaming career? You know, as an esport winner. Okay, maybe I should, you know, get Vegapunk to sign my underwear before he gets famous. Then my underwear would, you know, worth $1 million. Good business idea. I am currently studying, you know, for my exam on Saturday. So today's topic is, like, you know, the blood vessels in your brain and the disease for it. So, you know, that's what it is. That's what it is. So today, no games. No games for today. But I will be studying right here, right now. So welcome to the 60th study stream. Today is plus 60 healing. So we have actually reached a landmark. Not landmark, like a milestone. A milestone? 60. Damn. I am so studious. Is that how you say it? Studious? Studious? I don't know. English is hard. What did you say? Wait, because, you know, I somehow cannot have chat on my OBS. Maybe, okay, let me try to fix it. Is that a thing? There we go. What a fucker. Okay, it doesn't show. I'll fix it later. Send it? Send it where? Send what to where? Exam on Saturday? Oh my god. You know, good luck. Good luck to us both. You know, but my past exam was okay. I passed. Not completely A, but, you know, I can't ask for too much. I just need to pass. Occupation factor, sorry. Life expectancy, comorbidities, modifiable risk, optimized. Last incident of stroke, antiplatelets. Pros and cons of endovascular treatment. Ooh. Oh, okay. Wait, what's next page? Endovascular stenting procedure. Ooh. Local anesthesia. Okay. Dual antiplatelet, heparin and warfarin. Synchronous stenting for multiple lesions, extracranial, carotid artery. You know, I'm not a doctor, so I don't know, you know, what kind of stent I should pick for the patient. I would never know. I will never know. Okay, next slide, I suppose. 50 plus and you're 50 plus what? What's the unit? 50 plus what? Like dislikes from YouTube? I don't know. 50 plus underwear? Like 50 plus like corn cobs? I don't know. What's the unit? Why do I sound like a primary school teacher? Like, oh, you can't write 20. What's the unit for 20? You know, if you didn't write the unit, I am going to deduct 1 point from your homework. Oh,
I am so self-righteous. I am being such a good educator.
Sorry. I don't know. You know, because, you know, when I was a kid, I always get, you know, my score deducted by like maybe 2 or 3 because I forgot to write down the unit.
What 50? Like 50 meters?
How long is Tom's dick? It's 50 meters. Oh. Sorry, it's actually 50 millimeters. Okay, it's just 5 cm, I'm sorry. Okay. Marks. Oh, 50 plus marks? I see. Okay, same. Just a pass. Just a pass. Just a pass, and we are happy. Wait. Let me try this one. Okay, let me play this music. As usual, I still have the MooBot on, so if you want any like song recommendations, you want some songs to be played, just type in !SR followed by space and add in the URL. Hopefully it's YouTube, hopefully it's copyright free, and hopefully it's safe for work. Okay. Let's try this one. Okay, this seems chill. Okay, let me lower it down in the volume. Is this good? Okay, maybe a little bit lower. You need it lower. Maybe a little bit. Okay. I think this is fine. I think this is fine. Oh my god. Something classical? Later. I can't have Mozart just, you know, come in and wreck the show. I need to study after all. Oh shit, I crossed out the wrong thing. Myocardium. This one I know. I don't need that. Pow. The song name on YouTube is called Perfect Cat. Purrfect and cat. Okay, so maybe I will send it to my friend. Okay, I'll send it to my friend because he likes this kind of shit. Okay, here you go. I've sent it to my friend. Hopefully he would like it. I like it. It's kind of chill. Pretty nice. Yes. Intercalated disc. Me. Oh, calcium-induced calcium release. Okay, that one I know. PNS. ACH2 muscarinic receptor in SA node. Potassium ion efflux. Okay. Membrane hyperpolarization, increased slope and hyperpolarization, reduce heart rate. Okay. Wee. Are the guys having fun? Guys having fun, you know, and listening to me just rant about how shitty my life is? How shitty my life is, especially in studying. You know, no one likes studying. I don't. Like, really. You know, one day I talked to my hairdresser. You know, he thinks that I'm, you know, I'm one of the I look smart, you know, those people who, you know, is good at, like, who is, like, performing well academically. But I'm like, maybe, but I don't want to study. Like, really, I don't want to study anymore. I have been studying for 20 years. Sir, guys, let me go. It's enough. 20 years is enough. I don't want to study anymore. Neurogenic pulmonary edema. Okay. Catecholamine, okay. Binds with alpha and beta adrenergic receptor. Okay. Peripheral and pulmonary vasoconstriction. Myocardial band cell necrosis. Jesus. Platelet aggregation. Embolism, pulmonary artery pressure, increase. Okay. Endothelial damage. Okay. Left ventricle dysfunction. What the fuck is a catecholamine? Okay, let me see. Catecholamine. Catecholamine. Okay. Shit. Catecholamine. What is that? Don't show me Chinese. I need English. I don't need to read what catecholamine is in Chinese. Okay, good night, crocodile. You're sleeping already. I thought it's still like 6. It's like 6 in the evening for you. Unless you've you've moved to somewhere else. I don't know. Monoamine neurotransmitter. Okay. But how does it happen? Oh, you're having a headache. This is headache 2. I don't know. Get some rest. Get some rest. Lie down. Have a rest. If it hurts a little bit, just put, have your bed slightly inclined, your head slightly inclined, like your upper body and your head slightly inclined. So hopefully it would help with your headache. Sometimes turning would make it better or worse, just so if there is a direction or a position that would help you ease your headache a little bit, just try it. Do it. My god, I'm burping a little bit. Okay. Alpha adrenergic receptor. Okay, necrosis. Myocardial band cells. Platelet aggregation, embolism, endothelial damage, left ventricle dysfunction, peripheral and pulmonary vessel vasoconstriction. Oh, basically just everything just adds up to, the resistance to blood flow and blood pressure. Increase work, like work for the heart as well. Oh, free. Catecholamine is bad. Okay. Increased capillary permeability, neurogenic pulmonary edema. Pulmonary cardiovascular, cardiopulmonary impairment. Okay. I see. Did I miss anything? Okay, text. Neuropsychiatric syndrome, stroke prevention. Okay. Cross this out. Wait. Almost 8 p.m. That's early. But I mean, if you're feeling unwell, just go to sleep, okay? Rest well, and I wish you a good night. Okay, rest well, please. You still have a long way to go. A long way to go in terms of your studies and your gaming career. Okay? Work hard, work well, and be the best gamer of all times. And when you hit that point, sign my underwear. Sign my underwear so I can sell it. I need money. Everyone needs money. Stroke prevention. Aim of stroke prevention. So prevent stroke in patients who never had a stroke and prevent recurrence of stroke. That's kind of bullshit. I mean, it's obvious, right? No one wants a stroke. Non-pharmacological approach. So lifestyle modification, hypertension, atrial fibrillation, diabetes, myocardial infarction, large artery disease, high cholesterol, smoking, alcohol, sedentary, and obesity, sickle cell disease, carotid stenosis. Okay, pharmacological approach. Cholesterol managed with statins as first-line treatment, and secondary prevention to atherosclerosis. Okay. Aspirin for antiplatelet, more apparent in low-risk groups. Clopidogrel, dipyridamole, and xylostazole. That's all antiplatelets. Okay. Dual antiplatelet therapy. DAPT. 啊八字啊八字啊八字啊八字啊八字啊八字。Kissy face, kissy face. Red hearts, red hearts. Me. I can feel. Don't you want me like I want you, baby? Don't you need me like I need you? Sleep tomorrow, but tonight go crazy. All you gotta do is just meet me at the okay. Dual antibiotic therapy, aspirin and cloppy. Okay. More effective than single, but increased risk of systemic hemorrhage and ICH. Given in less than 3 months and for high-risk groups. Chat study criteria. Apatsu? 2013 AHA guidelines for stroke. Aspirin with or without cloppy. Okay, use Plavix. Aganox DB. Aspirin daily. Okay. More than aspirin. Okay. I am sleepy. Risk factors for stroke. No shit, Sherlock. Psychological stress. Oh, Sniper's here. Hi. Nintendo Direct sucks real hard. Why? I mean, I turned on Twitch and I noticed the like they're announcing Switch 2, but what's the details for it? I didn't really have time because you can see that I'm studying, but I can't show it. I can't show this to everyone because I failed to capture the Windows Notepad and the Windows photos. I cannot do that. That's it. Ratio of apolipoproteins B to 1A. What is that? Cardiac causes. Like cardioembolism. Secondary prevention. Carotid revascularization, of course. Vascular risk factor control. Okay, reduce blood cholesterol with statins. That's what we said earlier. Warfarin. Target INR 2 to 3, 2.5 to 3.5 for mitral valve replacement. Constant monitoring. Warfarin over aspirin in stroke prevention in atrial fibrillation. Okay. Warfarin. Dual oral anticoagulant. Non-valvular AF. Okay. Valvular AF metallic valve. Wait. I just want to be over with my study and I dropped my hairband. Moderate to severe renal and or liver impairment. Okay. The games that are exclusive to Switch 2 will not be playable in Switch 1. What? That's bullshit. So they're just trying to, have people buy the Switch 2 instead. But what games are Switch 2 exclusive? Okay, and also another question, like, can I use the Switch 1 charger for my Switch 2? I hope they're not being an ass to all Switch owners, but they kind of are. Like, game exclusively for Switch 2. Are you kidding me? That's bullshit. Patient on drugs. Glycoprotein substrate and rifampicin. HIV protease inhibitors. Azole antipsychotics for drug compliance. CHADS2 VASC for ischemic stroke in patient with AF. Upgrade packs are paid content for older games.
Wait, what do you mean by upgrade packs? What is that? Upgrade packs. Or did you mean like DLC? Congestive heart failure. Okay. Congestive heart failure. Hypertension. Age. DM. Prior stroke. Vascular disease. Age. Wait, why does it? Oh. Sex is female. Okay. Let's save. The price for Switch 2. Wait. Let me see. Let me enlarge this. The price for Switch 2. Wait. You mean for 9.99, right? How much is it? Let me see. 550. Okay. No. 450. 450 USD. I am not sure if that's expensive or not. I mean, at least it's cheaper than an iPhone. It's cheaper than an iPhone. But I'll just wait it like fall a little bit. Like maybe like drop it by $50 or something. Then I'll buy it. Let's fuck them. Fuck Nintendo for, you know, fucking everyone up. Okay. Heart failure, congestive heart failure, hypertension, age larger than 75, diabetes, stroke, and vascular disease, age, and sex. Okay. Unbelievable. Okay, what's your ideal price? Because, you know, like different countries have different purchasing powers. So maybe $450 is very expensive in India, but maybe $450 is not that expensive in some rich countries. I don't know. I don't know if it's too expensive. Wait, I need to check again. Because I remember buying my Switch 1 like around like 2000 something. No, not 2000, but you know, HKD 2000 something. Let's see. Two. Okay, like maybe like $320 somewhere there. I remember that's how much I bought it 5 years ago. I can't believe the Switch is like I bought my Switch for like 5 years already. Jesus. I mean, I had a lot of fun time, especially during COVID. That kind of pushed me to become a streamer. A little bit. Not so much. $1.3, $2.2, $3, $4, $6, $9. Okay. Coagulation if score more than 2. Okay. The food. Okay, instead of updating the Switch to make it better, which would be the cheaper option? Nintendo makes a completely new Switch in the Switch 2. Sell it. Well, you know, they did kind of foretold that Switch 2 is coming out. I know, but what's the difference between Switch 1 and Switch 2? You know, despite, you know, the exclusive content. I don't mind the content. You know, I don't care about the content, but you know, but mechanically or in terms of hardware, is there a difference? You know, I don't want them to walk the path of Apple, just, you know, having everything like more or less the same, but you know,
and they just jacked up the price for like 200 by 200 or 400 bucks. Like, it's bullshit. Okay, has bled score for ICH in patients with AF on warfarin. Whoa. Hypertension, abnormal liver, or... Okay, abnormal liver or renal function, stroke, bleeding, labile unstable INR, elderly, and drugs. High bleeding risk for 3. If higher than 3, okay. N-STATES apathy alcohol, okay. I don't know. Left atrial appendage closure if cannot tolerate. Atrial appendage closure if cannot tolerate oral. Okay, sure. Anticipated console because every new console was released, okay. But people found out that it didn't run well, so Nintendo did what? The last message. Okay. But honestly, I would say it's a tad bit too expensive, but you know, I'll wait a while. Then, you know, the price will fall. Maybe, hopefully, a little bit. I don't know. The economy is bad. I don't have that much money. I don't have that much money. Wait. Okay. Okay. SAH, subarachnoid hemorrhage, and ICH. Okay. Lumbar puncture, CTA, DSA. Okay. To predict risk of vasospasm, CT classification Fisher. No SAH, diffuse, lot thicker than 1. Okay. Modified Fisher, 0, no SAH, thin SAH plus IVH, okay. Thick, okay, mimics. Blood plus protein, slow flow stagnation. Ooh. So I suppose you're not buying the Switch 2, right? If you say it that way. Initial management ICU, nil by mouth, prop up 30, 2 liters of oxygen, IV fluids and normal saline, plus 20 millimole of potassium chloride. So it's just salt. Okay. Keep SBP lower than 140. Intake and outtake input-output monitoring fully to okay. Routine blood, chest X-ray, echocardiogram, heart block, anticonvulsant, analgesics, antiemetic, I don't know, you know, something that stops vomiting. Coiling clipping. Okay. 23.7 versus 30% death rate. Okay. Okay, I see. Coiling technique, General anesthesia, femoral puncture. Established good support guiding catheter. Deployment of first coil. Okay, heparin IU. Okay. Infusion. Ooh. Okay, I'll pick it up later. Avoid overpacking in ruptured case. Okay. Complications. Hypertension, hematoma, heart failure, hemorrhage, hypoperfusion, hydrocephalus, hypovolemia, and hyponatremia. Fuck me. Cushing's triad. Hematoma.
No. Why is everything so hard? The sky, the gods are making fun of me.
Pulmonary edema is caused by increased ICP. Really? Reduce ICP. Remove excess fluid ventilation. Okay. Free. Okay. Hypoperfusion, vasospasm. Pathogenesis. Okay. Smooth muscle contraction. Okay. Endothelial injury. Inflammation remodel. Okay. Neuropsychiatric syndromes. Last slide and I'll shut off stream. But I need to rest. Neuropsychiatric syndromes. Okay. DSM-5 criteria. Post-stroke depression. Markedly used for 2 weeks, diminished interest or pleasure in almost all activities. Feeling of worthlessness or excessive guilt. Cannot concentrate, indecisiveness. Recurrent thoughts of death and suicide ideation, attempt, or specific plan. Significant unintended weight loss, change in appetite, insomnia, hypersomnia. I mean, I did have hypersomnia. Fatigue, low energy, lethargic, psychomotor agitation and retardation. Nearly every day. Shit. That's what I'm saying. PSD, more prevalent in acute rehab and outpatient setting. Demographics, female, old age, lower education level, live alone, lack of family/social support. Okay. PSD group more likely to have severe deep white matter hyperintensities. Deep white matter hyperintensities is an independent risk factor of PSD. Okay. Correlated to default mode network connectivity, also correlated to increased cytokines, decreased serotonin and norepinephrine. Neuroticism, a tendency towards anxiety, depression, self-doubt, and other negative feelings, which is me. Oh, no. Neuroticism. Everyone has that, I think, in the modern world. Stressful life event exposure in the month preceding stroke onset. Okay. Outcome measure for PSD, geriatrics, depression. Hospital anxiety depression scale, visual analog mood scale, pharmacological fluoxetine, okay. Cognitive behavioral therapy, motivational interviewing, outreach, education, and support. Okay, I'm saying. Emotional incontinence. Presence of excessive or inappropriate laughing, crying, or both, as compared with a premorbid state, more than 3 occasions. Correlated to infarcts in cortical, frontal, and basal ganglia. Cerebral microbleeds. Oh my god, wait. I need to raid. Hang on. Sniper, I'm almost off stream, by the way, because, you know, this is the last slide that I'm going through. The price leaks have been released for Mario Kart 9. 9? They're still going for Mario Kart. They're just milking it. They're just milking it at this point. PSD group more likely to have severe deep white matter and blah blah blah. Okay. Okay, I'm done with today. I'm gonna go rest. Okay, so Sniper, and I hope this is here. So thank you so much, you two, and maybe I hope maybe other people as well, you know, for coming in here. But so you know, hold your horses about the Switch, Sniper. You can continue in on Discord. Okay, I'll read it. I will read your message on Discord. Why do you decide to throw me? Like throw shit at me, huh? If you redeem, you know, you have points to redeem. You know, do something else better, okay? Maybe just yeet me into space, okay? Anyway, I will not let you yeet me into space because I'm shutting off stream, okay? Thank you so much, guys, for coming in, and I'll see you. Maybe not tomorrow. Tomorrow is Thursday. I need to do see a patient. Maybe Friday. Maybe. But, you know, Saturday I will be having an exam, so maybe I'll stream on Saturday. I don't know, but I'll see you later. I will announce my stream schedule